Have you ever felt something strange happen to your body, only for it to disappear a few minutes later? Maybe your arm suddenly felt weak. Maybe your words came out wrong for a moment. Or perhaps your vision became blurry before returning to normal. Many people brush these moments aside. They tell themselves, I'm just tired, or it must be my age. But what if your body was trying to warn you about something much more serious? A stroke often seems sudden, but in many cases, the body sends warning signs first. These signs can be easy to miss because they may last only a few minutes or feel too mild to cause alarm. That is exactly why they deserve attention. Today's video will walk through 7 silent stroke warning signs that adults over 60 should never ignore. We'll explain what each sign may mean, why it can happen, and when it's important to seek emergency medical care. Stay with us until the end because one of the last warning signs is often mistaken for normal aging, yet many people don't realize it can sometimes signal a medical emergency. Let's begin. As we grow older, our risk of stroke increases. That doesn't mean a stroke is inevitable, but it does mean we should become more aware of changes in our bodies. A stroke happens when part of the brain suddenly loses its blood supply or when a blood vessel in the brain bursts. Without enough oxygen, brain cells begin to suffer damage within minutes. The encouraging news is that quick medical treatment can make a major difference. In many cases, recognizing symptoms early and getting immediate medical care can improve outcomes and reduce long-term disability. Sometimes, before a stroke occurs, a person experiences what doctors call a transient ischemic attack, often shortened to TIA. You may also hear it called a mini-stroke. A TIA happens when blood flow to part of the brain is blocked for a short time. The symptoms may disappear quickly, sometimes within minutes, but that does not mean the problem has gone away. A TIA is a serious warning that a full stroke could happen soon. Anyone experiencing possible stroke symptoms should seek emergency medical attention right away, even if those symptoms improve. With that in mind, let's look at the first warning sign. Warning sign. Number 1. Sudden weakness or numbness on one side of the body. Imagine you're pouring your morning coffee. As you reach for the mug, your hand suddenly feels weak. Maybe you drop the spoon without knowing why. Your arm doesn't seem to respond normally. Or perhaps one side of your face feels different when you smile. These changes may last only a few minutes. Many people think they simply slept in an awkward position or pinched a nerve. Sometimes that is true. But sudden weakness or numbness affecting one side of the body is one of the most recognized warning signs of a possible stroke. Why does this happen? Different parts of the brain control movement and feeling in different parts of the body. If blood flow is interrupted, even briefly, those areas may not work normally. The result may include weakness in one arm or leg, a heavy feeling on one side, tingling or numbness, a face that suddenly droops, difficulty lifting one arm. One simple way to remember this is through the word fast. F stands for face. Ask the person to smile. Does one side droop? A stands for arms. Ask them to raise both arms. Does one drift downward? S stands for speech. Is their speech slurred or difficult to understand? T stands for time. If any of these signs appear, it's time to call emergency medical services immediately. Even if the symptoms disappear after a few minutes, they should never be ignored. Here's an example. Robert is 71 years old. One morning, he noticed that his left hand felt unusually clumsy while buttoning his shirt. The feeling lasted about 10 minutes before everything returned to normal. He almost ignored it because he felt perfectly fine afterward. Fortunately, his daughter encouraged him to go to the emergency department. Doctors later determined that he had likely experienced a TIA. They evaluated him, identified risk factors, and started treatment to help lower his risk of a future stroke. While every situation is different, stories like Robert's remind us that temporary symptoms can still deserve urgent attention. Never ignore. These 7 silent stroke warning signs. After 60, welcome back. So far, we've talked about 2 warning signs that many people recognize: sudden weakness on one side of the body and unexpected trouble speaking G or understanding words. Both can appear suddenly, and both deserve immediate medical attention, even if they seem to go away. Now let's look at 3 more warning signs that are often easier to overlook. They may seem unrelated at first, but each can happen when part of the brain isn't getting the blood flow it needs. One of these signs is especially easy to dismiss because many people assume it's just a problem with their eyes. Warning sign number 3. Sudden vision changes. Think about reading the morning newspaper or looking at your phone. Without warning, the words become blurry, or perhaps you suddenly lose vision in one eye, almost as if a curtain has been pulled over it. A few minutes later, your sight returns to normal. It's tempting to blame dry eyes, aging, or the need for stronger glasses, but sudden changes in vision should never be ignored. Your eyes depend on your brain to process what you see. If blood flow is interrupted to the parts of the brain responsible for vision, or to the blood vessels supplying the eye itself, you may notice sudden visual changes. These changes can include blurred vision, double vision, partial loss of vision, temporary blindness in one eye, difficulty seeing on one side. The key word is sudden. Vision that gradually becomes blurrier over months is more often related to common eye conditions such as cataracts or changes in prescription. But vision that changes all at once is different and needs prompt medical evaluation. Imagine David, who is 73. While watering his garden, he suddenly notices that the flowers on his left side seem to disappear. He closes one eye, then the other, trying to figure out what's wrong. Within a few minutes, everything seems normal again. He feels fine otherwise. Many people would simply continue with their day. But sudden vision loss, even if it lasts only a short time, can sometimes be a warning sign of a stroke or TIA. That's why healthcare professionals recommend seeking emergency medical care rather than waiting to see if it happens again. It's also important not to drive yourself if you're experiencing possible stroke symptoms. Call your local emergency services immediately so treatment can begin as quickly as possible if needed. Here's something many people don't realize. Vision changes may happen without pain. If there's no pain, it's easy to assume nothing serious is happening. But strokes are often painless. That's one reason they can be so dangerous. And the next warning sign is another example of something that can feel surprisingly mild at first. Warning sign number 4. Sudden dizziness, loss of balance, or trouble walking. Have you ever stood up too quickly and felt lightheaded for a few seconds? That can happen to almost anyone, especially if you've been sitting for a while. But stroke-related dizziness is different. It often comes on suddenly and may be accompanied by other symptoms. You might feel as if the room is spinning. You may struggle to walk in a straight line. Your balance may disappear without warning. You may suddenly feel unsteady, even on familiar ground. Because balance naturally changes with age, many older adults assume this is simply another part of getting older, but a sudden loss of balance deserves attention. Your brain coordinates movement, posture, and balance every second of the day. If blood flow is interrupted in the areas responsible for these functions, walking can become difficult almost instantly. For some people, this may feel like staggering while walking, losing coordination, feeling unusually clumsy, falling for no clear reason, severe dizziness that appears suddenly. Consider Helen, age 76. Another important point is that stroke symptoms are not always painful. Many people expect severe pain, but weakness, numbness, or facial drooping often occur without pain at all. That is one reason these symptoms are sometimes overlooked. As we move to the next warning sign, you'll learn about another symptom that many families mistake for simple tiredness or aging, even though it can sometimes be a sign that the brain is not getting the blood flow it needs. Warning. Sign number 2. Sudden trouble. Speaking or understanding words. Have you ever known exactly what you wanted to say, but the words simply wouldn't come out? Or perhaps someone spoke to you, and for a brief moment, their words sounded confusing, even though your hearing seemed normal. This can be frightening. Our ability to speak and understand language depends on several areas of the brain working together. If blood flow to these areas is interrupted, speech may suddenly change. Some people begin speaking with slurred words, almost as if they had been drinking alcohol. Others know exactly what they want to say but can't find the right words. Still, others may speak clearly but use words that don't make sense. Family members often notice the change before the person experiencing it does. They may say, "You're not making sense," or "Can you repeat that?" Sometimes the person becomes frustrated because they know something isn't right. This symptom should never be brushed aside as simple aging. Normal aging may slow recall from time to time. Nearly everyone occasionally forgets a word or loses their train of thought. A stroke-related language problem is different. It usually appears suddenly, not gradually. The change is often obvious and unlike the person's usual way of speaking. For example, imagine Margaret, age 68, calling her grandson. Halfway through the conversation, her words become difficult to understand. She tries several times to finish a sentence but keeps saying the wrong words. Within 15 minutes, everything seems normal again. It would be easy to assume the problem was stress or fatigue, but a sudden episode like this deserves immediate medical evaluation because it may represent a TIA or stroke. Doctors often stress that time matters. Some treatments for certain types of stroke are most effective when given as soon as possible after symptoms begin. That is why calling emergency services immediately is so important instead of waiting to see if it gets better. It's also worth remembering that not everyone experiences every warning sign. Some people may only have difficulty speaking, others may only notice weakness, vision changes, or dizziness. That is why learning the full range of symptoms is so valuable. And speaking of vision, the next warning sign surprises many people because it often affects only one eye or appears so briefly that people assume they simply need new glasses. In the next part, we'll discuss warning sign number 3, sudden vision changes, along with 2 more warning signs that are frequently overlooked but can signal a medical emergency. Before we continue, we'd love to hear from you. How old are you, and which country are you watching from? Sharing that in the comments helps build a supportive community where people can learn from one another and encourage healthy aging together. Never ignore these 7 silent stroke warning signs after 60. Welcome back. So far, we've talked about 2 warning signs that many people recognize: sudden weakness on one side of the body and unexpected trouble speaking or understanding words. Both can appear suddenly and both deserve immediate medical attention even if they seem to go away. Now let's look at 3 more warning signs that are often easier to overlook. They may seem unrelated at first, but each can happen when part of the brain isn't getting the blood flow it needs. One of these signs is especially easy to dismiss because many people assume it's just a problem with their eyes. Warning sign number 3. Sudden vision changes. Think about reading the morning newspaper or looking at your phone. Without warning, the words become blurry, or perhaps you suddenly lose vision in one eye, almost as if a curtain has been pulled over it. A few minutes later, your sight returns to normal. It's tempting to blame dry eyes, aging, or the need for stronger glasses, but sudden changes in vision should never be ignored. Your eyes depend on your brain to process what you see. If blood flow is interrupted to the parts of the brain responsible for vision, or to the blood vessels supplying the eye itself, you may notice sudden visual changes. These changes can include blurred vision, double vision, partial loss of vision, temporary blindness in one eye, difficulty seeing on one side. The key word is sudden. Vision that gradually becomes blurrier over months is more often related to common eye conditions such as cataracts or changes in prescription. But vision that changes all at once is different and needs prompt medical evaluation. Imagine David, who is 73. While watering his garden, he suddenly notices that the flowers on his left side seem to disappear. He closes one eye, then the other, trying to figure out what's wrong. Within a few minutes, everything seems normal again. He feels fine otherwise. Many people would simply continue with their day. But sudden vision loss, even if it lasts only a short time, can sometimes be a warning sign of a stroke or TIA. That's why healthcare professionals recommend seeking emergency medical care rather than waiting to see if it happens again. It's also important not to drive yourself if you're experiencing possible stroke symptoms. Call your local emergency services immediately so treatment can begin as quickly as possible if needed. Here's something many people don't realize. Vision changes may happen without pain. If there's no pain, it's easy to assume nothing serious is happening. But strokes are often painless. That's one reason they can be so dangerous. And the next warning sign is another example of something that can feel surprisingly mild at first. Warning sign number 4. Sudden dizziness, loss of balance, or trouble walking. Have you ever stood up too quickly and felt lightheaded for a few seconds? That can happen to almost anyone, especially if you've been sitting for a while. But stroke-related dizziness is different. It often comes on suddenly and may be accompanied by other symptoms. You might feel as if the room is spinning. You may struggle to walk in a straight line. Your balance may disappear without warning. You may suddenly feel unsteady, even on familiar ground. Because balance naturally changes with age, many older adults assume this is simply another part of getting older, but a sudden loss of balance deserves attention. Your brain coordinates movement, posture, and balance every second of the day. If blood flow is interrupted in the areas responsible for these functions, walking can become difficult almost instantly. For some people, this may feel like staggering while walking, losing coordination, feeling unusually clumsy, falling for no clear reason, severe dizziness that appears suddenly. Consider Helen, age 76. She gets out of bed one morning and suddenly feels as though the room is spinning. She reaches for the dresser because she can't stay upright. She waits 10 minutes. The spinning settles down. She assumes it was just an inner ear problem. Sometimes dizziness really is caused by conditions affecting the inner ear. However, when dizziness appears suddenly, especially if it's accompanied by weakness, speech problems, vision changes, or numbness, it could indicate a stroke affecting the back part of the brain, where balance is controlled. Only a healthcare professional can determine the cause. That is why sudden dizziness combined with other concerning symptoms should always be treated as an emergency. Many viewers are surprised to learn that not every stroke looks like the dramatic scenes shown on television. Some begin with symptoms that seem small, but acting quickly can make a tremendous difference. Speaking of symptoms that seem small, the next warning sign is one that families often notice before the person experiencing it does. Warning sign number 5. Sudden confusion or difficulty. Thinking clearly. Imagine sitting at the dinner table with your family. Someone asks you a simple question. For a moment, you can't understand what they're saying. Or perhaps you become confused about where you are, what day it is, or what you're doing. These episodes can be frightening. They may also be confusing for loved ones who might assume the person is simply tired or distracted. But sudden confusion should never be dismissed. A stroke can affect the parts of the brain responsible for thinking, understanding, decision-making, and awareness. When that happens, a person may suddenly seem unlike themselves. They may have trouble following a conversation, become unusually confused, forget what they were doing, struggle to make simple decisions, seem disoriented in familiar surroundings. It's important to understand the difference between gradual memory changes and sudden confusion. Many people experience occasional forgetfulness as they grow older. For example, forgetting where you placed your reading glasses or taking a little longer to remember a name is common. A stroke-related change is different because it usually happens suddenly. Family members often describe it by saying things like, "Mom was fine 5 minutes ago. Dad suddenly wasn't acting like himself. She couldn't understand what we were saying." These sudden changes require immediate medical attention. Here's another point worth remembering. Some people experiencing a stroke don't realize anything is wrong. That's why family members, friends, or neighbors play such an important role. If you notice someone suddenly becoming confused, struggling to speak, losing balance, or showing weakness on one side of the body, don't assume they'll feel better if they rest. Call emergency medical services right away. Waiting to see whether symptoms improve can delay treatment during the time when every minute counts. Researchers have shown that rapid evaluation after stroke symptoms begin can improve the chances of receiving appropriate treatment and may help reduce long-term disability for some people. That is why doctors often repeat one simple message: don't wait. The sooner a possible stroke is evaluated, the better. So far, we've covered 5 warning signs: sudden weakness or numbness on one side, trouble speaking or understanding words, sudden vision changes, unexpected dizziness or loss of balance, sudden confusion or changes in thinking. Many people believe these are the only symptoms to watch for. They're not. In the next part, we'll cover the final 2 warning signs, including one symptom that many older adults mistake for an ordinary headache or fatigue. We'll also discuss common stroke risk factors, simple everyday habits that may support healthy aging, and why recognizing these warning signs early could make all the difference. Never ignore these 7 silent stroke warning signs. After 60 Part 3, warning signs number 6 to number 7, stroke risk factors and everyday prevention. If you've been watching from the beginning, you've already learned about 5 warning signs that should never be ignored. Even if these symptoms last only a few minutes and then disappear, they still deserve immediate medical attention. Now let's look at the final 2 warning signs. The last one surprises many people because it doesn't always look like a stroke at first. Warning sign number 6, a sudden severe headache. Unlike your usual headaches, not every stroke causes a headache. In fact, many strokes happen without any head pain at all. But some strokes, especially those caused by bleeding in or around the brain, can begin with a sudden, very intense headache. People often describe it as the worst headache of my life, a headache that came out of nowhere, a pain that felt different from anything I'd ever experienced. The important word here is different. Many people have occasional headaches caused by stress, dehydration, eye strain, or poor sleep. Those headaches often build gradually and improve with rest, water, or appropriate treatment. A stroke-related headache is often different because it appears suddenly and may be much more severe than usual. It may also occur alongside other warning signs such as trouble speaking, weakness or numbness, confusion, vision changes, difficulty walking, loss of balance. Imagine Susan, age 69. She's reading a book in the afternoon when she suddenly feels an explosive headache that comes on within seconds. She also notices that her right arm feels weak. Instead of waiting to see whether it passes, her husband immediately calls emergency medical services. That quick decision could make an important difference. While many severe headaches are not caused by a stroke, a sudden, unusual headache, especially when accompanied by other neurological symptoms, should always be evaluated immediately by healthcare professionals. Never assume it's just a migraine, especially if you've never experienced headaches like that before. Healthcare providers have the tests needed to determine the cause. Before we move to the final warning sign, here's something worth remembering. A stroke doesn't always announce itself with dramatic symptoms. Sometimes the body sends quieter signals. And that brings us to our final warning sign, one that families often recognize before the person experiencing it does. Warning sign number 7. Sudden difficulty understanding everyday tasks. Imagine waking up and deciding to make breakfast. You've prepared coffee every morning for years. But today, something feels wrong. You suddenly can't remember the steps. You stare at the coffee maker without knowing what to do next, or perhaps you pick up your toothbrush but forget how to use it. This isn't ordinary forgetfulness. A stroke can affect areas of the brain responsible for planning, understanding, and carrying out familiar activities. When that happens, even simple daily tasks may suddenly become difficult. Someone experiencing this symptom may become confused while dressing, forget how to use familiar household items, struggle to follow simple instructions, have difficulty completing routine activities they normally perform with ease. The key difference is that the change happens suddenly. Normal aging usually causes gradual changes over many years. Stroke symptoms appear quickly, often within minutes. Imagine James, who is 74. Every morning he feeds his dog before breakfast. One morning he picks up the dog food but suddenly doesn't seem to know what to do next. His wife notices that he looks confused and isn't responding normally. A few minutes later, he begins speaking clearly again. It would be easy to assume he was simply distracted, but sudden changes like these deserve emergency evaluation because they may represent a TIA or stroke. Even if everything seems normal afterward, it's important not to ignore what happened. Remember, temporary symptoms can still be serious warning signs. Why acting quickly can matter so much. You may have noticed that one message has come up again and again throughout this video. Don't wait. There's a good reason for that. When brain cells lose oxygen, they begin to suffer damage within minutes. For some types of stroke, doctors may be able to use treatments that are most effective when given soon after symptoms begin. That's why recognizing the warning signs and calling emergency medical services immediately is so important. Trying to sleep it off, driving yourself to the hospital, or waiting until tomorrow could delay care during a critical period. Even if the symptoms disappear completely, they still need urgent medical evaluation A TIA is often a warning that the risk of a future stroke is higher, particularly in the hours and days that follow. Prompt assessment allows healthcare professionals to identify possible causes and recommend treatments or lifestyle changes that may help lower future risk. Who is at higher risk? Although anyone can have a stroke, certain factors increase the risk. Some cannot be changed. These include getting older, having a family history of stroke, being male or female in certain age groups, depending on individual risk factors. Other risk factors can often be managed with the help of a healthcare team. These include high blood pressure, diabetes, high cholesterol, smoking, atrial fibrillation, an irregular heartbeat that can increase stroke risk, obesity, physical inactivity, excessive alcohol use. High blood pressure deserves special attention because it is one of the leading risk factors for stroke. The challenge is that high blood pressure often has no symptoms. That's why it's sometimes called a silent condition. Regular checkups can help detect it early. If your healthcare provider has prescribed medication for blood pressure, cholesterol, diabetes, or another condition, taking it as directed is an important part of reducing stroke risk. Never stop a prescribed medication without discussing it with your healthcare professional. Everyday habits that support brain and heart health. The good news is that many healthy habits benefit both the heart and the brain. You don't need to change everything overnight. Small, consistent steps often make the biggest difference. Here are a few habits supported by well-established health recommendations. Stay physically active. Even regular walking can support heart health, circulation, balance, and overall well-being. Choose activities that match your fitness level and any guidance from your healthcare provider. Eat a balanced diet, focus on fruits, vegetables, whole grains, beans, healthy fats, and lean sources of protein. Try to limit highly processed foods, excess salt, and sugary drinks when possible. Know your numbers. Have your blood pressure, cholesterol, and blood sugar checked as recommended. Many conditions can be managed more effectively when identified early. Don't smoke. If you smoke, quitting is one of the most powerful steps you can take for your heart, brain, and overall health. If quitting feels difficult, ask your healthcare provider about available support. Get enough sleep. Poor sleep over time may affect overall cardiovascular health. Aim for regular sleep habits whenever possible. Manage stress. Life always brings challenges, especially as we grow older. Gentle exercise, time outdoors, hobbies, meditation, prayer, or spending time with loved ones may help reduce stress for many people. Every healthy choice is an investment in your future. No single habit guarantees that a stroke will never happen, but together, these habits can support overall cardiovascular health and may help reduce risk. We've now covered all 7 silent warning signs and several practical ways to protect your health. In the final part, we'll bring everything together with a simple recap, discuss the FAST method one more time, explain when to call emergency services without hesitation, and leave you with the most important message every older adult should remember. Thanks for watching my video, and thanks for your time, and subscribe my channel for my next videos.